My name is Gabrielle Saunders. I'm a student at Purdue University, earning my master's degree in public health. And I made this presentation to overview my experience working with data science on the Kraft Heinz consumption team. So like I said, I was part of the Kraft Heinz consumption team, and as a team, we created a web scraper to scrape Amazon for relevant data about mac and cheese. And we did this because Kraft is a leading competitor for the mac and cheese industry. We compared data from Kraft Heinz with other competitors like Annie's, Cheetos, and Bonza mac and cheese that also make similar products. First, the main thing we did was a background analysis on Kraft Heinz and its competitors. I played a large role in researching, doing a lot of background research on the restaurant industry and on Kraft Heinz and its mac and cheese and its competitors as it relates to our project. And then I investigated why mac and cheese in particular was being studied and looked up trends in the industry. We compared ratings as a team and reviews of Kraft Heinz and selected competitors on Amazon in terms of macaroni and cheese. And then we created a web scraper, and we were able to do overall sentiment analysis using natural language processing. There were a lot of different skills I learned. Overall, I did not have any experience in the data field other than using Excel before, so everything was a learning experience for me. I learned many skills about how to use and build scrapers, as well as just general data lingo and techniques that have been complete foreign language to me before. So I just had to be open to learning things at every stage of the project. Because I didn't have a strong background in data, I did a lot of background research and the aesthetic work on presentations. Some of the tasks in data processing were too advanced for me to complete at this stage, but overall I think the most important skills I learned were professionalism skills. In terms of professionalism, I learned how to communicate with leaders, mentors, and employers in an appropriate way. This includes online meeting etiquette and internet etiquette, which I learned a lot about overall. I learned communication skills with my team leader, Purdue faculty, and Kraft Heinz team leaders as well, including online communication. It was somewhat difficult for me to adapt to remote learning, but I learned how to work as a team when we were all separate from one another, which was definitely a key thing to learn in current times. While doing background research, I learned about the restaurant and food product marketing, and I feel like I learned a lot of the why behind the how of the project, which proved to be very valuable. I learned to be open to new experience, and I learned the value of curiosity in education, which is why there's the picture of the child, reading the book and kind of having like a realization moment about, something learned, which is just kind of what I want my education to be about overall. I never thought I'd work with data, but now I'm thinking of using data predominantly in my public health career. Why this project mattered to me is because I'm graduating this summer with my master's in public health degree. Data is all over the medical field, and if healthcare workers want to improve their practices and keep people safer, they have to look at their success rates, which are statistics and which is data. Public health professionals must look at what has been happening overall in their field, and then when they make changes and interventions and do studies, they need some way to analyze differences that were made, which involves data. In my personal application, like I said, I'm getting my MPH with Purdue. I'm an intern with the National Alliance on Mental Illness in West Central Indiana, which is trying to start a program called The Living Room. It's a place where people in mental health crisis can go as an alternative to the emergency room, and these people will be seen by a psychiatrist and peer support staff free of charge, and then given further resources upon discharge. I've been involved in this project by writing a grant proposal to gain funding, and there are several things funders want to know, which is why the program is needed and how the difference will be made. These questions involve data analysis as the answer. I could analyze emergency room visit rates and outcomes for mental health, and then I could analyze data about availability of mental health providers and the wait time needed to see these providers. And then to look at how a difference is made afterwards, I can compare average bad mental health days across different counties in Indiana and look at bad mental health days in Tippecanoe County before and after the program had started. I could also analyze provider availability and wait times in the emergency room versus in the living room. Overall, this is an overview of data in public health. So in the past 10 years, the National Center for Health Statistics and state vital record offices have improved vital record registration methods in the country. And because of this, data on death is available a week after the event, whereas people used to have to wait 60 days after death occurred. And there's been a push to improve data collection systems during the pandemic. Michigan, for example, has improved their death registration system and their disease surveillance system, which allowed the state to see that death rates were higher in its African American population, and then they were able to develop a task force that reduced racial disparities in health during the pandemic, and kind of to become early adopters in the trend of, not a trend, but in the prevention of disparities, rather than, kind of trying to play catch up and taking the downstream approach towards health. There's also been innovation recently in public health data systems. For example, RiskScape is a program that was created for public health surveillance of electronic health records. It allows surveillance of data and judgment of clinical practice, and it includes presentations of data like heat maps of occurrence by zip code, and it's flexible enough to encompass new changes from stuff like the pandemic. It basically is a program that looks at basic health records and analyzes individuals' health records, which is very innovative in technology currently. And finally, data can also be applied to specific cases of disease outbreak in epidemiology, which is something that is very instrumental in public health, and it can be used to make recommendations for public health as well. In Canada, tuberculosis mortality was studied in comparison to mortality of other diseases. So it used time-dependent Cox regressions and concluded that for a given year, if someone were to be diagnosed with TB, his or her risk of non-tuberculosis mortality was 69% higher than if not diagnosed with tuberculosis. And finding this statistic allows for recommendations to be made, so healthcare providers need to pay attention to people who have tuberculosis, not from dying from the actual tuberculosis disease, of course, but from dying from other conditions, which is kind of eye-opening. And it really shows how in public health, data can really make a difference, and it's a necessary part of public health, so I'm so glad I got this opportunity and this internship to work with data, even though, macaroni and cheese isn't necessarily relevant to public health, but the process behind it and, using data scraping and data analysis is so completely relevant that I hope every public health student gets a chance to actually do something like this and to use public health and data in public health in the future, because I think that's where public health is going. I think the future of public health is in data science. And I'd like to thank everyone who mentored me throughout my data internship and in public health as well.